Hi, my name is Caleb Fuller, and I'm here today to introduce to you our group case study. The topic of this case study is an individual named H.W. He is a 48-year-old African-American male visiting his primary care physician for his annual health checkup. It is noted that H.W. is a professional truck driver. He once was an avid weightlifter, but due to his profession, his exercise has been limited. He has a history of treated high blood pressure, and his chief complaint is an unquenchable thirst and frequent urination. His physical exam revealed a blood pressure of 127/89, a heart rate of 64, a weight of 225 pounds, a height of 5 feet 8 inches, putting him at a BMI of 34.2. An exam of his family history showed that his father died at the age of 65 due to a heart attack. His mother, who is alive and well, has a history of type 2 diabetes as well as hyperlipidemia. His social history revealed that he was a former smoker. He smoked 1 pack per day for 20 years. He quit 10 years ago when he was 38. He also drinks alcohol 3 to 4 times a week, in which he has approximately 3 to 4 beers with each sitting. He's also on lisinopril 20 milligrams once daily to treat his high blood pressure. Critical thinking. Which findings would alert you to the possibility of diabetes? Although many times there are no symptoms for prediabetes, an unquenchable thirst and frequent urination are classic diabetic signs. Other factors that increase his risk for diabetes also include his African American heritage, his history of high blood pressure, his alcohol as well as his tobacco consumption, his family history, and his obesity at 34.2 BMI. The second critical thinking question. Based on these findings, which 2 laboratory tests would you recommend be ordered for this patient? 2 tests commonly ordered to check for diabetes are the A1C and the fasting plasma glucose. The fasting plasma glucose is the preferred method to diagnose diabetes because it is easy to do, it's convenient, and it's less expensive than other tests. This test does, however, require that patients are fasted up to 8 hours prior to taking the test. The second test, the A1C, measures the amount of glucose that sticks to red blood cells. The advantage to this test is that it allows you to see the patient's blood sugar levels over a range of 2 to 3 months, an average range. His lab results did come back and revealed a slightly elevated lipid profile, as well as a fasting plasma glucose level of 123 milligrams per deciliter, putting him in that pre-diabetic category. Nursing interventions. At this time, nursing interventions would focus on nutrition education, the institution of an exercise program, and the need for support. Nutrition education would focus on basic nutrition principles such as what are macronutrients, proteins, fats, carbohydrates, and which food groups fit into each one of these categories. After consultation with this physician, HW should also begin an exercise program. According to the National Clearinghouse, individuals with prediabetes that have lost weight ranging from 2.6 kilograms to 7.1 kilograms through lifestyle modification over a 3-month period have shown significant improvements in their fasting glucose levels, their lipid profile, and their blood pressure. Up next, Michelle is going to go over some of the pathophysiology associated with prediabetes.